Doctors nationwide are puzzled by a mystery illness paralyzing children as young as 4 years old. It's called acute flaccid myelitis, or AFM for short. It attacks the nervous system, targeting the spinal cord, leading to weakness in the arms and legs, eye problems, droopy eyelids, difficulty swallowing, and slurred speech. Doctors say AFM is not contagious and is rare. The CDC first saw an outbreak in 2014, and so far this year there have been 62 confirmed cases in 22 states across the nation, but those numbers could be higher. I found 2 more right here in Central Texas and discovered healthcare providers are not required to report AFM cases to state health officials.
I like it.
He loves to be around people. He loves to be around people.
I do like this song.
Nana.
Who's there?
From the moment we first met Joshua,
Banana.
Banana who?
Banana hamburger.
he wanted to play.
He always finds a way to be able to connect with somebody immediately.
Yeah,
let's go get her.
Come on, let's go find her.
But he couldn't get up and run like he used to,
We're gonna find you.
because Joshua is still trying to find his way.
He's still unable to move his legs, completely paralyzed.
It started in July when his mom, Jennifer, said Joshua had a cold, then a fever. And when he tried to use the restroom in the middle of the night, he fell to the ground. Suddenly, the soccer-loving 5-year-old couldn't walk.
He was unable to wiggle his toes or even lift his leg up.
When she took him to the ER, Jennifer says doctors at Dell Children's Medical Center said Joshua had AFM, and within days of getting that cold-like virus, he was paralyzed from the neck down.
Listening to that was the worst thing I ever heard. I cried, of course.
And when she asked doctors how and why, they couldn't answer.
We really don't know what's causing it in some kids now, and there definitely needs to be more research.
Emergency room doctor Eric Higginbotham says Dell Children's Medical Center has seen upwards of 6 suspected cases this year.
Some of these kids recover from it, but some kids, once they have that nerve damage, there's not really a way to heal that, and so they stay in a sort of weakened condition.
It happened to 5-year-old Evelyn too.
How are you feeling today, Evelyn? You feel good?
The kindergartner was rushed to the hospital earlier this month when her mom, Virginia, noticed the left side of her little girl's face was drooping and her body was weak.
Then the next day is when she started complaining about her neck hurting and she couldn't move and she couldn't sit up by herself.
After 2 weeks of intense therapy and treatment, Evelyn can go home with only some weakness in her arm.
She's a lot better, and we're happy, and they've been working with her, the therapy, and like I said, I feel that the therapy is key.
But doctors say Evelyn is
Very lucky, yeah.
because not every child walks away from AFM.
Let's move lefty first. I'll help you.
Kids are meant to walk. They're meant to run, right? To fall and get bruises on their legs. And it breaks my heart. It breaks my heart. It's very sad.
There is no treatment plan for AFM. Joshua spent a month and a half in the hospital. His mother says he regained the use in his arms because he got intense therapy 3 times a day while there, but once they got home, that was over. Jennifer says their insurance does not cover much because AFM is considered to be so rare and recently denied to pay for Joshua to be treated at a facility in Baltimore that specializes in AFM treatment. And without it, Jennifer wonders if he will ever get the help he needs to walk again. Sally Hernandez, KXAN News.
Thanks, Sally. CDC has been researching the cause of AFM since 2014, but since it's only voluntary for doctors to report the condition to health officials, it's difficult to study any trends. This morning on NBC's Today Show, panelists discussed how researchers have recently announced they might have discovered a virus that's responsible for this disease. EVD68 is a polio-like virus that is not new, but started ramping up in 2014. That's right around the time doctors started seeing an increase in AFM cases. The next step is to try to develop a vaccine for that virus or even a cure. The best advice for now: wash your hands. Online now, resources for parents to learn more about this mysterious illness, the symptoms, possible causes, and places you can go for help. It's all at the homepage at kxan.com.